My name is Patrick Shie, and I work with Knowledge Network for Disease Control and Vigilance, KNCV Nigeria. I'll be presenting my abstract, titled Data to Life, Harnessing Epcon to Eliminate Hidden TB and HIV Hotspots. So these are my co-authors. Outline. We're talking on, my outline will be on background, conclusion to acknowledgement. Conflict of interest disclosure. The authors declares that there is no conflict of interest regarding this abstract. Background. TB and HIV co-infection among pregnant women remain an under-recognized contributor to maternity, morbidity, and mortality in sub-Saharan Africa. In challenging areas like Katsina State, proactive idea is transmission of hotspot is vital. This is vital because early detection can also lead to early diagnosis and treatment of those positive pregnant women that have been detected in those high spots, Epcon high spot sites. As a result of this, the Epcon platform, a real-time predictive mapping tool, was also developed. The essence of this Epcon was to also map out hotspots of where there will be likely TB and HIV yield of pregnant women, thereby extending life-saving services to those most at risk. Method. As well as method deployed during the intervention. The intervention started from December 2024 to September 2025. A community-based intervention was selected across LGAs in Katsina State using EPCOM hotspot mapping where there are high TB yield areas. So what we do with this is EPCOM will dictate where there are high positive rates of TB and HIV. So what we do is to share out those wards or those particular places where there are high TB use to our CBO. We call them community-based organization. So these CBOs in turn now channel their outreaches to those particular hotspots that have been predicted by Epcon. So how they work as a team, they go out in trained teams, which consist of the community, which consists of the community TB HIV workers, CTWs, also the mentor mothers, and also the community volunteers. So why testing for pregnant women is being done why testing of HIV for pregnant women is being done? The pregnant women are also screened for TB, which include the signs and symptoms of TB, such as cough for more than 2 weeks, weight loss, drenching nights, and fever. So at the end of during the outreaches, for those that were tested positive, they have been linked to care by the mentor mothers. For those that turned out to have signs and symptoms of TB, their sputums are being collected by the community TB HIV workers, where they have been taken to the lab for diagnosis, and results are being followed up. For those that turned out to be positive TB cases, they have been linked to the hub for treatment so that this TB cannot be spread in the community. So as when they are done with these outreaches, data of these testings being done in those hotspots that have been mapped out by the Epcon are being captured by the community volunteer in real time using the Epcon Google Sheet dashboard, thereby enabling immediate review and program adjustment. What was the result from this intervention? As you can see from my graph, you can see that all the pregnant women that came were all screened for TB and HIV. Out of those screened, 11.3% had signs and symptoms of TB, which I mentioned earlier, such as cough for more than 2 weeks, weight loss, drenching night sweats, and also fever. Out of those that had signs and symptoms of TB, their sputums were being collected and taken to the lab for diagnosis. Out of those that were being diagnosed, we have 2.3% that were confirmed to be TB cases. And for those pregnant women that were tested for HIV, we have a positivity rate of 0.09%. In terms of figures, 1,924 pregnant women were screened for TB, 217 were reported to have signs and symptoms of TB, 5 were confirmed to be TB cases. 1,155 pregnant women were tested for HIV, where we had one HIV positive patient, giving us a positivity rate of 0.09%. In overall, there were higher TB symptoms identified hotspot more than where Epcon were not identified. In addition, integrating Epcon mapping technology into community intervention significantly improve the detection of cases among pregnant women. This approach helps in the sense that when we have when EPCOM predicts those particular hotspots for us, we usually go out there to ensure that we carry early detection that can lead to early diagnosis. So, when these people are tested, for those that have turned out to be HIV positive, that have been linked where they take their antiretroviral therapy, thereby suppressing or reducing their viral load to less than 19, making it impossible for them to transmit this virus to their unborn babies. And for those who turned out to be TB positive, they are also being linked to the hub where they have been taking their TB medication to ensure that they don't go to the community to spray this TB across. So scaling up this model will also accelerate efforts to eliminate TB and HIV among vulnerable population, starting with our mothers in the community. As a way of acknowledgement, I want to first of all appreciate the organizers of this conference, Artificial Intelligence in Infectious Disease Workshop, Knowledge Network for Disease Control and Vigilance, KNCV Nigeria, my principal employer, National Tuberculosis, Bureau Ulcer and Leprosy Control Program, NTP-LCP, Institute of Human Virology, Nigeria, my principal PR, the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Thank you for listening.